We now move on to our next segment on ecosystems as catalysts for healthcare innovation. This conversation explores the power of ecosystems and how they are driving the next wave of healthcare innovation. Please join me in welcoming Phil McCoy, CIO, Optum. Phil has held numerous senior roles across United Health Group, UHG. Prior to his current role as Chief Information Officer of Optum, he served as Interim CEO for Rally Health, Executive Vice President for Digital Transformation at United Health Group, and Chief Information Officer of United Healthcare. Over to you, Phil.
Thank you, and greetings from Minneapolis, Minnesota. And thank you for this opportunity to join you at this prestigious conference. I only wish we had the opportunity to all be together in person. I would much rather be enjoying the warmth of Mumbai than another wintry morning here in Minnesota. I attended my first NASSCOM over 15 years ago, and I had the honor to present at the 2019 conference. Over the past 15 years, I've seen the technology industry in India continue to grow in its reach and its impact. As the CIO of Optum, I am particularly proud of our association with NASSCOM and all of its member companies. Over the years, our engagement has helped bring greater focus to important industry topics, and our collaboration has contributed to creating a productive business environment, to promoting intellectual capital and innovation, and strengthening the depth and the diversity of our talent pool. These are all key to creating ecosystems that will fundamentally transform how people experience healthcare. We've seen it happen in retail, and I had a front row seat helping to lead the consumer digital experience at Target. Retail has become a fast-moving digitized space where technology makes things better, simpler, more cost-effective, and more convenient. Now it's time to bring that to healthcare through ecosystems that are collaborative, effective, simple, and secure. One example of this ecosystem is United Health Group itself, which includes United Healthcare and Optum. We're a company that touches every aspect of healthcare. Our mission to help people live healthier lives and make the health system work better for everyone. We do this through two distinct and complementary businesses, Optum and United Healthcare. Both are focused on improving access, affordability, outcomes, and experiences. Optum delivers care aided by technology and data, empowering people, partners, and providers with the guidance and tools they need to achieve better health. United Healthcare offers a full range of health benefits, enabling affordable coverage, simplifying the healthcare experience, and delivering access to high-quality care. Across both businesses, we are developing and deploying modern technology to make the health system work as a system for people and with people at the center. We serve close to 150 million people. But it's not about size and volume. We know healthcare is deeply personal, and our people are focused on creating a healthier world, one insight, one connection, one person at a time. Optum Technology is an engineering group of 32,000 talented individuals who represent a trusted innovation and delivery partner inside United Health Group and across the industry. Our team supports all of our engineering and technology needs. India is at the heart of this engineering organization, with about 40% of the team located in this amazing hub of tech talent. Over the years, our India operations have matured to support strategic IT operations, product development and management, and business operations. We're applying technologies such as artificial intelligence, deep learning, and natural language processing across the entire healthcare value chain. And we are building deep industry expertise with data, advanced analytics, re-engineering and automation, among other emerging technologies. We've all been impacted by the COVID-19 pandemic, our families and our communities. Our team in India has experienced profound loss. It has also impacted the way we work. It's accelerated the role that technology plays in connecting people to the care they need. One of the biggest trends accelerated by COVID-19 is the center of gravity for healthcare shifting away from large hospitals and other physical care locations and closer to our homes. Use of telehealth is currently 38 times higher than it was pre-pandemic, and that convenience is here to stay. 83% of patients expect to use telemedicine after the pandemic. Many consumers did their best to educate themselves on care for COVID-19. We've seen this in the heightened focus on mental health and an increase in the use of digital therapeutics. And as patients grow more active in managing their care, the consumer, the individual, the person has become the center of healthcare decision-making, and it's accelerating. As these trends continue, healthcare organizations must keep pace. We must become more consumer-focused and more connected, supporting people in simpler and more cohesive ways. An ecosystem approach requires building out the system's connective tissue, because true innovation in technology, it isn't about designing another killer app to fix just one slice of a healthcare journey. It's about connecting people to their care teams, connecting payers to providers, and ultimately connecting a disconnected system so that it works better for the people it was created to serve. It's about simplifying the entire experience, end to end, with digital innovations grounded in human-centered design. Today, our industry has the data and analytic capabilities to help make care more precise, more effective, and more equitable. We can build new ways to listen and respond to people's needs. From integrated platforms and data that help physicians deliver more personalized, outcome-driven care, to an ecosystem of virtual care and services that wrap around the needs of our patients. These innovations make the healthcare system work as an actual system. So how do we build the connected, resilient, person-centric ecosystems that healthcare needs? I believe there are 5 key components. The first, intelligent data streams that deliver informed insights by combining shared data, predictive analytics, AI, and clinical expertise. This calls for creating a consumer-centric platform that uses intelligent technologies and a rich, interoperable data library to enable equitable care for people across their entire healthcare journey. Best practices include predictive digital signals to fire intelligent alerts to identify when a meaningful clinical event occurs. For example, when remote patient monitoring data can be used to predict negative patient events. It also calls for integrating mental and behavioral health, medical and pharmacy solutions to give clinicians a holistic view of the patient. For a senior trying to manage diabetes and hypertension and struggling with depression at the same time, it means they are surrounded by a care team and services that have a comprehensive view of that person and their needs. Salesforce, Google, Amazon, and others tap into tremendous opportunities when they use platforms to create products and services for the consumers they serve. Healthcare needs platforms. Platforms that talk healthcare and have the interoperable services in a library of building blocks engineers can use to build new products for the future. The second key component, digital workflows that can coordinate across segments in real time using shared clinical, claim, and patient data to optimize existing experiences. One way payer-provider ecosystems are doing this is by integrating technologies into the clinical workflow. For example, clinically intelligent guidance to deliver care, delivered at the point of care. This is decreasing turnaround times and operating costs while improving clinician and patient experiences. State-of-the-art ecosystems also use real-time data to generate qualitative and quantitative insights. For example, natural language processing enables clinicians and payers to surveil and intervene with patient panels and member populations before, during, and after clinical interactions. This enables us to anticipate and predict patient needs in real time and actively intervene virtually and in physical care settings. Integrating unified clinical data and technologies into payer and provider workflows is the key to driving value-based care models forward. Care models that are focused on the best outcome for each person. The third component is care channels that provide consumers access to care services and pharmacy information, including virtual visits. Leveraging the immense talent of our teams here in India and worldwide, we are integrating physical care, virtual care, home care, and behavioral care in new ways. One example of this is the Optum Virtual Care Platform. This platform was launched in 2021 and will scale to serve nearly 14 million Americans in close to 50 states by the end of 2022. By using ongoing advances in AI and analytics, it's possible to build custom models that are not only faster, but are also predictive at an individual level. These kinds of models can even determine a patient's likelihood to accept a given treatment. With the high cost of medications, AI is being used to offer proactive prescription savings alerts to help people save money on medications as well. It's care that addresses all of a person's needs, physical, mental, social, however, wherever, and whenever they need it, in their home and community. The fourth component to this ecosystem are financial pathways that access health savings accounts, cost estimators, financial planning tools, and digital payment options. The financial side of healthcare creates frictions for everyone, the complexity and the lack of transparency. And unexpected healthcare costs is one of the single biggest drivers of financial crisis for American families today. It's ripe for transformation by bringing the same convenience to payment that people already experience in the retail environment. By integrating technologies and applying knowledge of healthcare to simplify payments, we can deliver more value to everyone, from consumer to provider to payer. We're going to take paper out of the process, making payments instant and improving cash flows. The end result for a provider is less complexity and greater efficiency. And for people, more convenient and trusted payment options that help them manage how they pay for care. The fifth and final component are wellness portals that provide consumers access to health assessments, education, coaching, and other tools to stay healthy and connect with others. Examples within United Health Group include United Healthcare's partnerships with Peloton and Apple Fitness that are being used to help keep people engaged in their health. Some payers and employers are also offering hypertension coaching programs. Elsewhere, remote patient monitoring technology is driving real results in reducing inpatient admissions and deaths and increasing life-saving interventions. At the end of the day, we believe companies will come together to form ecosystems that will in turn compete and also collaborate with other ecosystems. It's only through new collaborations and innovations that we will be able to drive true healthcare transformation for the people we have the honor to serve. Because people, patients, consumers, clinicians, they are at the center of it all. And they're counting on us, the technology community, to get it right. A patient-centric approach to healthcare is rapidly becoming a cost of doing business. Today, more providers anticipate their patients' needs, involve the patient in their healthcare journey, and provide the best care at the most convenient location. Providers can no longer wait for these people to come to them. Instead, health leaders must use technology to better serve people, guide them, expand access, and design products and services around their needs. Before organizations can address the wants and needs of people, they must first understand who they are on a clinical, financial, and social level. And while much of this data is already accessible to health leaders through EMRs and claims, we also need to consider the social factors that impact a person's health. Because if basic needs aren't met, then medical needs won't be met either. That's why increasingly platforms that support home and community care will be so important. This means clinicians spending time in patients' homes, assessing their environment to ensure basic needs are met. Do they have food, water, electricity? And checking patients' bottles of medication to see if they're taking them correctly. The focus is on the whole person and coordinating their care holistically. The integration of healthcare and technology is accelerating at a pace we've never experienced before. In the future, healthcare will be defined by the interplay between people and the systems, applications, and tools created by software engineers and developers. Engineers, developers, you, all of us, will be the ones to create ecosystems that connect people, technology, data, and clinical expertise. We have the opportunity, I would say we have the responsibility to transform an entire sector of the economy at scale by using advanced AI, the latest digital technologies, and put them to work for people, our friends and families and our neighbors. That is our focus, people, knowing them, understanding them, guiding them, and serving them. Giving people access to care on their terms, where and when they need it. Making their healthcare experience simple and affordable. It's an incredible opportunity that we have to spend our time and talents pursuing an ambitious yet humbling mission to make healthcare better for everyone. Thank you.
Healthcare for everyone. Thank you for your wonderful thoughts, Phil. It was a pleasure to hear those insights on healthcare innovation. The pandemic has definitely escalated the role of tech. Healthcare organizations must become more consumer-focused because in the future, healthcare will be definitely defined by the interplay between people in the system, applications, and tools created by engineers.